There is a vitamin sitting in millions of American medicine cabinets right now that most people over 60 believe is completely safe to take with anything, and for years their doctor never said otherwise. That belief that B12 is just a harmless supplement you can pair with everything else is quietly causing real neurological damage in people who think they are doing everything right. What makes it so dangerous is not the vitamin itself, it is what happens when it meets two very specific medications that millions of older adults take every day without a second thought. My name is Dr. Mae Jemison. I am an internal medicine specialist with more than 28 years of practice focused on adults over 60. I have treated thousands of patients managing complex medication routines, and I have watched more times than I can count a well-meaning supplement routine quietly undermine the very medications a patient depended on to stay healthy. What I am about to share is the kind of conversation I have behind closed doors in my exam room, the kind most people never get before something goes wrong. Stay with me, because this is information most people never receive until it is already too late. Before I get into the two medications, I want you to understand how your body handles B12 after 60, because this is where everything starts to make sense. B12 is not like most vitamins. It is absorbed through a system involving something called intrinsic factor, a protein your stomach lining produces that acts as a carrier, escorting B12 into your bloodstream. Think of it like a private shuttle service. Without the shuttle, most of the B12 you swallow never makes it into your blood. Here is the part that changes everything after 60. As we age, stomach acid production naturally declines, and stomach acid is what activates intrinsic factor in the first place. Less acid means less active intrinsic factor, which means less B12 reaching your bloodstream, even if you take a supplement every day. According to the National Institutes of Health, roughly 10 to 30% of adults over 50 already struggle to absorb B12 from food or supplements due to reduced stomach acid alone. 1 in 3 people who genuinely believe their B12 is working when their body is barely processing it. And this is where the two medications change the entire picture. Because what I am about to describe is not a minor interaction. I am talking about a physiological interference that either blocks B12 absorption almost entirely or depletes B12 reserves your body spent decades building. Both medications are so routine that most patients and many physicians never think to mention them alongside a vitamin. That gap is what I am here to close today. The first medication is one of the most prescribed drugs in America for adults over 60, Metformin. If you have been diagnosed with type 2 diabetes or prediabetes, there is a real chance you are on it right now. The American Diabetes Association estimates more than 37 million Americans have diabetes, and Metformin is the most commonly prescribed first-line medication. Most of my patients who take it feel fine, their blood sugar improves, and their numbers look good. They assume the story ends there. But here is what almost nobody tells you when they hand you that prescription. Most people are told Metformin controls blood sugar, and that is true. What they are not told is what it does to the calcium-dependent receptors in the terminal ileum, the last section of your small intestine. Those receptors complete the absorption of the B12 intrinsic factor complex. Metformin directly interferes with them. Think of it this way: your B12 shuttle arrives at the station on time, passengers ready, but Metformin has locked the gate. The shuttle cannot dock. And this does not happen occasionally, it happens with every dose, over months and years. A landmark study published in Diabetes Care, cited by the American Diabetes Association, found that long-term metformin use is associated with a significant reduction in B12 levels, with research suggesting up to 30% of long-term users develop B12 deficiency. And here is the human side. B12 deficiency in adults over 60 does not announce itself as an emergency. It creeps. It shows up as tingling in the hands and feet, dismissed as poor circulation, fatigue chalked up to getting older, a vague mental fog that feels like normal aging. And it can go on for years, quietly damaging the nervous system, before anyone connects it to a B12 level that was never checked. I want to speak to you directly right now. If you are taking metformin or someone you love is, hear this clearly. The medication is not the villain. Metformin saves lives. But every person taking it long-term should have their B12 monitored. If nobody has raised this at your last several appointments, it is not because it does not matter. It is because in a 15-minute appointment, these interactions fall through the cracks. That is the reality of modern medicine, and it is exactly why you are here today. If you have a parent, a spouse, a sibling, or a close friend over 60 managing diabetes with metformin, save this video right now and send it to them. What I am sharing could change the questions they ask at their next appointment. And sometimes asking the right question is the only thing between a person and a crisis they never saw coming. I want to tell you about one of my patients. Her name is Margaret. She was 67, a retired hospital administrator, meticulous about her health. 6 years on metformin, blood sugar well controlled. But she described a dullness in her thinking. She told me, "Doctor, I used to finish the crossword puzzle every morning. Now I get halfway through and just lose the thread." She also had foot numbness she figured was from standing too long. Never mentioned either symptom to her doctor because she did not want to complain about things that seemed like aging. We checked her B12. It came back at 187 picograms per milliliter. Healthy for her age is closer to 400 to 500. Deficient for at least 2 years, taking a B12 supplement the entire time. The metformin had blocked her absorption so consistently that the supplement was barely touching her serum levels. Within 4 months of switching to a sublingual B12 that bypasses the gut, Margaret told me the crossword puzzle was back. That matters more than any number on a lab report. Go to the comments right now and type yes if you are currently on metformin and you have never specifically had a conversation with your doctor about your B12 levels. Just yes. I read every comment on this channel, every single one, and that number tells me exactly how many people this video reached at exactly the right moment. Now the second medication. And this one surprises people even more, because it has nothing to do with diabetes. I am talking about proton pump inhibitors, PPIs, omeprazole, pantoprazole, lansoprazole, esomeprazole, brand names like Prilosec, Prevacid, Nexium, Protonix. Among the most prescribed medications in the United States, used for acid reflux, GERD, stomach ulcers, heartburn. Genuinely necessary for many people. I am not asking anyone to stop taking them. I am asking you to understand what they are doing to your B12 while they work. Here is the mechanism, and once you understand it, you will not forget it. PPIs reduce stomach acid dramatically. Less acid means less reflux, that is the point. But stomach acid is also what separates B12 from the food proteins it binds to, and what activates the intrinsic factor that escorts B12 into your bloodstream. Remove the acid, and you remove 2 critical steps in the entire B12 absorption chain. Think of it like shutting off your home's water main because one faucet ran too hot. The problem faucet gets fixed, but now nothing else in the house gets water either. A study published in JAMA and cited by the National Institutes of Health found that long-term PPI use, 2 or more years, was associated with a 65% increased risk of vitamin B12 deficiency. 65%. And millions of Americans over 60 have been on PPIs not for 2 years, but for 5, 10, 15 years, often because the original prescription was never revisited, the acid never came back. And neither, in many cases, did adequate B12 absorption. What does that look like in a real person? It looks like someone who gets increasingly fatigued and assumes it is age. Someone whose balance starts slipping, who reaches for the wall more than they used to. Someone whose memory and concentration gradually fade to the point where family members quietly wonder if this is dementia beginning. And the tragedy is that in many of these cases it is not dementia. It is a B12 deficiency growing in the background for years because nobody connected the PPI prescription to a vitamin level that was never checked. B12 is essential for the myelin sheath, the protective coating around your nerve fibers. Think of the electrical wiring in your home. Every wire has insulation that keeps the current moving correctly. B12 is that insulation for your nerves. When it degrades slowly over months and years, signals start misfiring. Balance gets worse, sensation in the hands and feet becomes unreliable, cognitive processing slows, and in severe prolonged cases, the damage becomes permanent. The National Institute of Neurological Disorders and Stroke has documented irreversible nerve damage in adults with long-standing undetected B12 deficiency. Not temporary, permanent. That word deserves a moment to land. I want to pause here and ask you directly, are you on a PPI right now? And has your doctor ever brought up the connection between that medication and your B12 levels? If the answer is no, go to the comments and write no. I want to see how many people watching this today have never had that conversation, because that number matters to me. Here is exactly what to do with everything you just heard. Call your doctor and ask for 2 tests, a serum B12 level and a methylmalonic acid test. Write those down before you close this video. The methylmalonic acid test catches deficiency even when the serum level looks borderline. Both are standard, covered by most insurance. Next, if you are on metformin or a PPI long-term, a regular oral B12 tablet may not be solving the problem. You cannot absorb your way out of a disrupted pathway. Ask your doctor about sublingual B12, dissolves under the tongue, bypasses the stomach entirely, or B12 injections if deficiency is already significant. And if you have been on a PPI more than 2 years, ask at your next visit whether your current dose is still the right fit. That is not questioning your doctor, that is good medicine. Think of someone you know right now, a neighbor, a close friend, a spouse, a sibling, someone over 60 managing reflux or blood sugar who has never heard a word of what you just heard today. Send this video to them, not as a warning, as a gift. The chain that starts with watching this can lead to asking a question that leads to a test that leads to catching something before it becomes permanent. One tap, that is all it takes. I want to be honest with you, not as someone making a video, but as a doctor. I have sat across from patients who came in frightened about early dementia, the forgetting, the fog, and discovered the driver was a B12 deficiency progressing quietly for years behind a medication nobody connected to a vitamin level. I have watched those patients recover clarity they believed was gone. I have also sat with patients where the window had already closed. Every time I come back to the same thought. The gap between what a patient knew and what they needed to know. Filling that gap is the only reason I am here today. So here is everything pulled together. B12 is essential for your nervous system, brain function, and energy. And after 60, your absorption is already naturally declining. Metformin disrupts the intestinal receptors that complete B12 absorption, and up to 30% of long-term users develop deficiency without knowing it. Proton pump inhibitors strip away the stomach acid that drives 2 critical steps in B12 processing, raising deficiency risk by 65% with long-term use. Both show up as fatigue, numbness, balance problems, and cognitive fog, easily mistaken for normal aging. Ask for serum B12 and methylmalonic acid testing. Discuss sublingual or injectable B12 with your doctor. Revisit your PPI duration if you have been on it more than 2 years. The patients who caught this did not have better luck. They had the right information. That is the only difference. If this video gave you something real today, share it. There is someone in your life right now. A husband, a wife, a sibling, a parent, a close friend over 60, who has never heard any of this. Send it to them. That one act may be the most important thing you do today. And tell me in the comments, are you on metformin or a PPI, and has your doctor ever discussed your B12 levels? Write yes if they have, write no if they have not. Next week I am going to show you 5 common medications that silently deplete magnesium in adults over 60, a mineral so critical to heart rhythm and sleep quality that its deficiency has been linked to nighttime cardiac events in people with no prior heart history, not discussed in most office visits. Hit subscribe and turn on the notification bell, because if today mattered, next week is going to matter even more. Before I go, everything I shared today is general medical information based on published research and 28 years of clinical experience. It does not replace your personal medical care. Before making any changes, especially to medications, please talk to your own doctor. They know your full history, they know your body, and that conversation, informed, direct, and unhurried, is exactly where good medicine begins.